my boyfriend's HIV positive. We don't want to use condoms. We want to have unprotected sex. I want him to come inside me.
We know for a fact that some men don't and will not use condoms when they're having sex.
Among those who took the pill every day, the risk of HIV reduced by more than 99%.
This pill allows me not to live in fear any longer.
I think really it's a game changer in the prevention field.
But would you ever go on PrEP?
If I were HIV negative?
Yeah.
No.
Really?
Really?
You wouldn't?
I would not.
Hi there, I'm Nicholas Casimir with Daily Extra. Imagine there's a pill that you can take every day, just like a birth control pill, that can shield you from HIV. Well, according to some people, such a pill exists. In Daily Extra's 4-part series, we look at the history, controversy, and promise of pre-exposure prophylactics, otherwise known as PrEPs. In this opening segment, we introduce you to what PrEPs are and how they work. Is this another false start in the fight against HIV, or the game changer we've all been waiting for?
We can end HIV transmission around the world, starting in cities like Toronto and San Francisco and places like that. But it can end around the world, but only if people are willing to put it on the radar screen.
I think a lot of folks, because there's been so many decades of condom use, that we think that's just the simple answer to everything. Unfortunately, condoms aren't used all the time for a variety of reasons.
In the clinic, when we have somebody come in, it's like, my boyfriend's HIV positive. We don't want to use condoms. We want to have unprotected sex. I want him to come inside me. I mean, that's a really difficult situation to be in and say, give the official green light and say, yes, by all means, go for it.
I was always worried when I would not use a condom. But in certain situations, it was wrong, but it happened just, I think, like it happened with everyone. Everyone at some point in their, well, most of the people at some point of their life slipped. And we cannot be responsible also for another person. We can't be 100% say that our boyfriends, husbands, lovers are 100% faithful.
Now, what is PrEP or PEP?
Well, they're different things. PrEP is pre-exposure prophylaxis, and PEP is post-exposure prophylaxis. All right, PEP came around in the late 90s, and that was the use of antiretrovirals after an exposure to prevent the virus from taking hold in the body. Pre-exposure prophylaxis is the use of HIV medications on a daily basis before an exposure. The idea is that if the virus gets into your system, you've already got protection against it.
PEP comes after the exposure, and the research is still a little bit out on that, on the effectiveness of it. PrEP, on the other hand, I look at it with my patients as another tool in the arsenal to help prevent HIV infection. It's something that is taken before there's an exposure to HIV.
We know that post-exposure prophylaxis is hard for people to use for several reasons. One is they have to wake up in the morning and realize that they need to take immediate action to start post-exposure prophylaxis. Then they have to find a doctor who's willing to write a prescription, they have to find a pharmacy that's willing to fill it, and all of that has to happen within 72 hours of the exposure. And so the idea behind pre-exposure prophylaxis was to engage with people in a calm moment. Not the morning after, but when they're thinking through how are they going to stay safe as they pursue their social goals.
So in July 2013, I came up as a negative man, HIV negative man, who is taking PrEP. This pill allows me not to live in fear any longer, and this is a very liberating experience.
In 2012, the FDA approved daily Truvada for PrEP in men and women, and that recommendation or approval was based upon 2 different studies. One, Partners PrEP, which is using PrEP in heterosexual men and women, and also data from the iPrEP study, which was in men who have sex with men as well as trans women who have sex with men.
So you conducted spearheaded a series of studies, correct, in regards to PrEP. What were the results?
The study that we've completed is called the iPrEP study, and it enrolled nearly 2,500 gay men and transgendered women. We enrolled people around the world. Among those who took the pill every day, the risk of HIV reduced by more than 99%.
Wow, so we're talking people who were taking the pill more than 4 times a week. We're talking 7 times a week, like a daily, like an aspirin or a daily vitamin.
That's right.
It's a medical intervention, so we haven't seen medical interventions around prevention as far as sexual activity is concerned. We really have been pushing condom use and reduction of number of sex partners and those sorts of harm reduction techniques. I think really it's a game changer in the prevention field.
I'm not a spokesperson for Truvada. I'm giving you my opinion, and I don't want anyone to take my word for it. I think that everyone has to do research and make up their mind.
That was part 1 of our 4-part series on PrEPs. In the next part of Daily Extra's original online series, is PrEP's promise of condomless sex a cause for alarm or celebration?
There are people that will absolutely swear against condom usage. That's the reality.
DailyXtra.com. Everything news. Everything arts and entertainment.
Do you still see yourself as a feminist?
I've always seen myself as a post-feminist.
How unusual!
Everything travel.
London has the most architects per square foot in all of Europe.
So this is a perfect place for us to enjoy and relax.
Everything events. Everything gay, every day. DailyXtra.com.
It may feel disingenuous now to talk about condomless sex and still having protected sex, right? Because PrEP is the protection without the condom.
There are circumstances in which we know that people are not using condoms or not using them consistently, and one of those circumstances is when they fall in love.
Would you ever go on PrEP?
If I were HIV negative?
Yeah.
No.
Really?
Really?
You wouldn't?
I would not.
Hi there, I'm Nicholas Casimir with Daily Extra. Welcome to the second part of our 4-part series on pre-exposure prophylactics, otherwise known as PrEPs. In this episode, we look at the failure of condoms. Usage among gay men is down. Can PrEPs fill the gap, or will it lead to more problems?
For 30 years, we've gotten messages that you use a condom, use a condom, use a condom, and it's irresponsible to not use condoms, right? A lot of us old guard, condoms, when the FDA and the CDC and Washington was not paying attention to us and gay men were dying, we were the group that rallied around our own health. And condoms were our advocacy, they were our support. And so it may feel disingenuous now to talk about condomless sex and still having protected sex, right? Because PrEP is the protection without the condom.
We know for fact that some men don't and will not use condoms when they're having unprotected sex. Okay, I would much prefer to have someone on PrEP who would be using PrEP as a method to prevent HIV infection rather than nothing at all.
A condom is a wonderful thing. They are our first line of defense against HIV as well as other sexually transmitted infections. They also prevent pregnancies. But there are circumstances in which we know that people are not using condoms or not using them consistently. And one of those circumstances is when they fall in love. I mean, I've heard many of our study participants and many PrEP users say using condoms all the time really worked for me well until I fell in love, and then they wanted a more intimate sexual experience, and that led to potential exposure to HIV because their partner may or may not be infected with HIV, may or may not have a positive test. I think that there's certain types of sexual experiences that occur very rapidly and they occur before people have time or even the initiative to put on a condom.
Condom sales are down over the last 5 years, so it doesn't appear that condoms are being used as often.
From my point of view, I think we have to accept that condoms will not be used all the time by everyone, and that we need alternatives.
If you don't get fucked, you may not need PrEP. If you get fucked all the time and don't use condoms, PrEP might be a good thing. It's
a very attractive proposition to use a pill, which by some researchers are saying is safer than condom. Condom is given 98%, I think, and lots of researchers are giving 99% to PrEP.
The majority of people go out and they are planning to have sex. So what we do here at Magnets kind of have a discussion with our patients about what are they doing when they're planning for sex. Are they using condoms? Do they take condoms with them? Do they get so drunk or party so hard that they forget completely about it? Well, there is a small minority of people who do things like that, then they don't remember, or alcohol impedes their thinking.
I'm curious because you just said a minority of people say that they don't use condoms. Is it small?
The reality, probably not. There are people that will absolutely swear against condom usage. That's the reality. I'm not a government official to say you have to use condoms all the time. It's not what we do here. We look at what puts people at risk and then look at alternatives to say what would be the best thing for you.
Are you concerned at all this is a bit of a Pandora's box? Because condoms, apart from, HIV and other, they actually work for other diseases as well.
Sure.
And PrEP is effective only for
HIV, correct.
HIV.
But it's the box was open a long time ago.
Really?
Pandora's box is open a long time ago. We do tell people that there are other STDs that you can get. We have very high rates of syphilis in San Francisco right now. So it's important to talk about the benefits, both in terms of protection for both HIV and other STDs, what will and won't work, right? PrEP won't work for syphilis, but if you're sucking dick and don't want to use condoms, you can still get syphilis that way. Versus the benefits of physical intimacy and what people are looking for in terms of sexual expression and connecting with somebody else. So it's helping them understand that it's not just about not getting a disease, it's about having an overall, what's your sexual health? That if you talk about health in that way, you can find what's really motivating for people and then help them understand what's the best resources for them to make certain, not that they're just not getting a disease, but they're having good sex.
Would you ever go on PrEP?
If I were HIV negative?
Yeah.
No.
Really?
Really?
You wouldn't?
I would not.
Interesting. What about your partner? Would he, you think, if you had a partner who...
Sure, he wouldn't.
Really?
There's been very little uptake of PrEP, actually.
Yeah.
I think that surprised folks, but there's little awareness about it, and there's little uptake of it. We don't know exactly why.
In the next segment of our video report, we'll look at the ongoing controversy surrounding PrEPs. PrEP is a major breakthrough.
It is.
Why is it so mired in controversy then?
Boy, that's a hot potato to hold on to.
DailyXtra.com. Everything news.
Like my mother's married to a woman.
You're straight, it doesn't matter. Just play the game, what you love to do, what you get paid for, that's it.
Everything life.
I definitely love guys with beards.
You do.
The ideal of femininity.
I don't think that that's what makes me a woman.
Everything travel.
Here we are, World Pride in London.
Everything events. Everything gay, every day. DailyXtra.com.
We have several concerns about the premature touting of PrEP as a prevention tool.
With all due respect to the AIDS Healthcare Foundation, they're the only organization that's being critical about PrEP.
44% effectiveness is not enough.
That is an important estimate.
Hi, this is Nicholas Casimir with Daily Extra. Welcome to the third part of our ongoing series about PrEPs, pre-exposure prophylactics. A daily pill that some believe can prevent you from getting HIV. It sounds great, but not everyone's convinced. It seems that the AIDS Healthcare Foundation is one of the few vocal critics of PrEP. Why do you think that is? Why is no one else really?
Well, we're not the only critics. We certainly were one of the first critics, or the first very vocal critics about using some caution when it comes to PrEP. We have several concerns about the premature touting of PrEP as a prevention tool. Adherence is a big issue with this protocol. We know that. Access is another big issue with PrEP. It's fairly expensive, about $14,000 a year. So it's really more of a privileged access to a prevention tool.
People like the AIDS Healthcare Foundation have been very critical and very vocal about their criticisms about PrEP. Why do you think that is?
Their concern is mainly how it is marketed. How is it distributed? Should it be something that is commercialized by a pharmaceutical company, or is it something that should be spread by doctors working with individual patients? And I think they prefer the latter. But I really don't hear, when I speak to them personally, a concern about PrEP Really, their concern, I think, is more how it is distributed in the marketplace.
Well, I did talk to someone there actually, but even going online, that they had like a stat saying 44% effectiveness is not enough.
That is an important estimate. That is the amount of HIV risk reduction that comes from offering a group of people PrEP. But that includes people who choose not to take it, right, or people who didn't take it.
Right.
And so it really is an average of 99% effectiveness among those who took it daily and 0 protective benefit among those who didn't take it at all. And so that averages out to about 44%.
PrEP is a major breakthrough.
It is, it is.
Why is it so mired in controversy then?
Boy, that's a hot potato to hold on to. I think you could look at it that PrEP could be a financial perk for some drug companies, because if you're buying it, it's not cheap. It's still, in the bigger picture, cheaper than trying to manage an HIV infection for 40 years. But you know, in America, we tend to get really focused on the dollars and cents of things.
If it's $13,000 a year for the average American, at least, to be able to afford it to be on PrEP.
$13,000 sounds like the list price for the drugs. Virtually no insurance company pays the list price. All of the negotiated prices are highly discounted. AIDS Healthcare Foundation, for example, has a highly discounted price for the drugs. And they're not unlike every other provider or insurance company. So people are able to find this drug for much less cost. And in Africa, it's the last price I heard was 31 cents a day.
I don't think it's just the cost. Adherence is a big deal. We know people who have cancer sometimes forget to take their drugs, or heart disease. You know, adherence rates are horrible with medications because humans are flawed.
It's all behavioral, right? People talk about condoms as being behavioral. Taking the pill is behavioral. So that's still there. And even taking a pill once a day may not be the easiest way for some people to do it. So they're looking at other ways. With all due respect to the AIDS Healthcare Foundation, they're the only organization that's being critical about PrEP.
You know, we don't know what the long-term effects are, what the long-term efficacy is going to be. You know, there's some research indicating there's possible kidney damage with the use of Truvada. We don't know how that's going to play out for negative folks.
How safe is the pill?
We have a lot of experience with this particular pill. This pill is used for HIV treatment as well as prevention. And there was really no impact on the liver, on people's thinking, on their mood. It was safe in many respects. We did see that, that about 1 in 200 people taking the pill had a decrease in their kidney function. But it was very easy to detect with a blood test that we recommend people have every 3 months. And as soon as they stopped taking the pill, their kidneys went back to normal.
A lot of men are not using condoms. Taking this pill could be misleading for them, especially if we haven't worked out the issues with adherence. Because if somebody's taking the drug and doesn't have a high enough level in their system and they acquire HIV, then they're likely to have resistance to that drug, therefore diminishing our ability to treat that newly infected person.
You're touching on the concern that maybe people who try to take this prevention pill and get infected anyway, that they may end up with a virus which is resistant to the drugs and they have to use other drugs to treat themselves. And that is always a concern that we have, but we did not see that as a significant problem in our studies.
In the next part of our ongoing report on PrEPs, we look at why so few are taking a drug that seems to hold so much promise. How many people ask you about PrEP?
On average, between 5 and 7 patients a week.
DailyXtra.com. Everything news.
Some people are uncomfortable with the word gay.
Everything life.
I consider my life to be a lot of drag.
Everything travel.
Museums and galleries, some of the best in the world.
Christiania is a hippie city in the city of Copenhagen.
Everything events.
It's a bit of a shindig for puffs, dykes. Anybody who wants to come along and join us?
Everything gay, every day. DailyXtra.com.
We're coming into contact with a wide variety of attitudes and opinions about PrEP. ranging from those who don't even know about PrEP, which is really surprising to me, to hostility around the fact that no, we shouldn't be doing this.
The manufacturer of the drug, Gilead Sciences, has decided not to advertise it.
The doctor said, well, you shouldn't do that, you should use condoms. Because there still is a lot of homophobia in the medical system, including there may be some gay doctors who think that gay men should always use condoms.
Hi, this is Nick Casimir with Daily Extra. Welcome to the fourth part of our series on pre-exposure prophylactics, otherwise known as PrEPs. The promise is great, a pill you take every day that prevents HIV transmission. Early studies are encouraging, but uptake among gay men is surprisingly low. As a nurse here, and I mean we're in the Castro, where gay men come in all the time and inquire and ask you, how many people ask you about PrEP?
On average, between 5 and 7 patients a week. Right now in this clinic, I'm seeing roughly 14,000 to 15,000 patients a year. They're coming here to get the information first because this is what we do. We are a sexual health clinic.
Oftentimes you have guys coming in who may want to talk to the doctor about PrEP, but they don't know how to talk to the doctor about PrEP because either they don't see the primary care doctor that often, or they try to talk to the doctor about PrEP and the doctor didn't know about it, or the doctor said, well, you shouldn't do that, you should use condoms. Because there still is a lot of homophobia in the medical system, including there may be some gay doctors who think that gay men should always use condoms. So I see it in our job is to do some education to the patient about how to be their own advocate with their primary care provider.
Only 6 to 8 people a week come and ask about PrEP, which is a very small stat given the influx of people that come in here.
Part of it is that there's not been a lot of education outside of the research world to talk about PrEP, right? The FDA approved it, so Truvada's been approved now for use for PrEP. But there's not yet been a lot of campaign talking about that. Gilead, who manufactures the medication, has said they're not going to do any direct-to-consumer marketing about this. This is not they're not pushing this.
Why not, you think?
Because they don't want to be accused of being in it for the profits that are associated with it, which is what AIDS Healthcare Foundation has largely been critical of, is the profits. And Gilead is saying, look, we're not going to do that. We're not doing direct-to-consumer marketing about it to tell people that they should take it, because it's up to the individual choice level for people to choose whether or not they want to go on PrEP.
We see ads all the time for drugs of every kind, not just for HIV treatment drugs, of happy couples leading normal and happy lives, and we see them for everything from birth control and onwards. But for PrEP, there hasn't really been anything. Why is that?
Well, the manufacturer of the drug, Gilead Sciences, has decided not to advertise it. And so that's why it's not advertised.
Do you know why? What is your take? Isn't it? It's sort of like a valuable tool by the sounds of it, and very effective when used correctly with for the right person. Why is it not advertised?
I think that they're relying on other people to promote this. I think that they think this should come from the community and healthcare providers rather than from their company. Their company is very successfully devoted toward treatment of viral illnesses, hepatitis C and HIV, and that is their focus. I think the prevention use of these medicines is something that they've supported to the extent that they've donated drug and placebo for the clinical trials, but they have not provided funding for the research, and they are not funding the advertisement of these drugs. And that's a decision that they've made based on their discussions with their stakeholders and their perception that this, if it's really going to work, has to come from community demand and health providers.
The lack of awareness around PrEP. We've had conversations with AIDS service organizations around the country. We're trying to put together a resource guide, and we're coming into contact with a wide variety of attitudes and opinions about PrEP. Ranging from ASOs who don't even know about PrEP, which is really surprising to me, to hostility around the fact that no, we shouldn't be doing this, or because we need to take care of HIV positive people first, that should be where we place the funding.
Do you think some of the resistance of people to accept PrEP in some practice or talk about PrEP is a moral issue? Is this whole idea that we're opening up a Pandora's box again of sexual promiscuity?
I think that's part of some people's concerns. I think we've seen concerns about changes in sexual practices what you call promiscuity, we've seen those concerns time and time again. In this particular case, we found that people who received the pill, and even people who thought it was working and thought they were getting the real thing in our studies, they tended toward having safer behavior. And so we didn't see this wildfire of sexual promiscuity. In fact, we saw the opposite. People tended to be safer. And so in some people, we saw condom use increase. We saw discussions about HIV testing results increase. We saw a community form around HIV prevention. And, you know, I think that people do get over it. I mean, in the end, we really, really do not want to get HIV. And I think that that is an overriding concern. And I hope that people can get over their anxiety about sex that comes up every time there's something that may enhance sexual health.
This concludes our 4-part series on pre-exposure prophylactics, but the discussion on PrEPs has just begun. Please log on to dailyxtra.com, our Facebook page, or our YouTube channel. Stay connected, and before making any decisions concerning your health, please consult with your healthcare professional.